Alright guys, so here's our attempt at trying to do the drug ads or the abstracts. It would help if you could send some examples this way, because I pulled these from the USMLE website that gives those free practice questions for us. And so we got several here, and we're trying to develop a kind of a process or a procedure to follow. And it helps if we had more questions that we can kind of use those through to make sure that we can implement it correctly and efficiently. So far what we're going to do is you're going to look for the math problems within. Always go to the answer choices first and look for the math problems, because those are the ones that we can zero in on, use the tables or the charts, and actually get those done first and right away. And then we're going to look for the other answer choices where we might have to actually read the entire abstract or drug ad and then get rid of the bad answer choices. But the main emphasis that I want to do is make sure you only use the answer choices that you can prove from the data. There's going to be answer choices that may look good, they may sound good, but at the end of the day, if you can't prove them from the data, then you really can't use those as an answer choice. There's got to be a better answer choice that's going to be out there. So it's just kind of a little bit of a process, but if you can send any questions, any drug ad examples that you have to that randy.neal8@gmail.com. I said we can use those, make a video, and just kind of run through these and put as many as these together as we can, just so when we get to the STEP exams, we'll be more confident and we won't kind of fear when we see those three questions that are connected together on that little box end. So hope this helps. Hope you enjoyed the video, and we'll see if it works. Okay guys, so we're going to try to solve these drug ad problems, and this is what we're going to kind of base this off of. I need you to know this formula, okay? And we don't ask you to memorize too many formulas, but this is one of those formulas to where you're going to have to actually know for the test. And really it's just going to be it tells statistical significance, okay? And it's going to come in handy. Now remember, when we talk about p-values, all we ever care about is 0.05 or less for the most part, right? Because that tells that there's some significance. So a correlating value of z, and just trust me on this for now, the correlating value of z is going to be 1.96. So when we punch in two different numbers in this little formula, what you're going to use, and you can kind of eyeball the number, is that if you come up with a 1.96 or that number is greater than 1.96, that means your equivalent p-value is going to be 0.05 or less, which will inform that there is significance, okay? So we're going to use this simple test to determine a score, and if that score is at least this number or greater, then it'll have a p-value that actually is meaningful, okay? So, need to know that. And how we're going to attack these problems is going to be this. I want you to scan the questions, and I want you to scan them for math problems, because we're going to attack the math problems first, because they're the ones that we're going to solve the easiest and the quickest. Number two, I'm going to say exclude the bad choices, okay? Every question has them. There's always going to be one or two that are just obviously not it, because the third step is we're going to select only what I can prove. Okay, and when I say what you can prove, is that it's only what's based on the information given to you, because there's going to be choices that sound good, but at the end of the day, I'm only going to choose the ones that I can prove are there, okay? So, just your basics, and these are for the drug ads and all the abstracts and all that kind of stuff. I want you to know this formula, because it will come in handy at some point, because it'll give you a score. We're looking for a score 1.96 or greater. Use your calculator. Scan the questions first, look for math problems, exclude the bad choices, and select only what you can prove, okay? So here's the question that was taken. Basically, this is taken from the USMLE.org practice questions, and you can see it's pretty long. This is an abstract. Now, I'm not going to say you got to read this right off the bat, but you scan it and then move straight to the questions, okay? Here are the questions that came with this thing. There's 3 of them, right? So they look, this is pretty extensive, but let's just look at them real fast. This one, again, always go to the last sentence and ask what the question is. Approximately how many patients must be treated with EPCS rather than EST? Now, EPCS stands for emergency portal-cable shunt, and then EST stands for endoscopic sclerotherapy. So they're just 2 procedures, long story short. To prevent one case of recurrent portal systemic encephalopathy. So when they say that, how many patients do I need to treat to prevent one? Okay, well they're saying number needed to treat. Okay, well we know from that very first video that the number needed to treat is actually the absolute risk reduction. Okay, and the absolute risk reduction broken down is the event rate control minus the event rate treatment, or backwards and forwards. We don't care because it's the absolute value. So essentially, I don't care which one comes first. Just put the bigger number, whichever one's easier to subtract. So anyways, this is a math problem. Good. Which of the following is the most strongly limits the generalizability of this study? Okay, so this one means I have to read the problem. Okay, so that's going to be one I'm gonna wait a minute to do. The third one says, which of the following conclusions is most appropriate based on the results presented in the table? Okay, well, if it's based on the table, then to me, that's going to be some type of math problem. So initially, I'm just going to do these first two choices because I can immediately go back to my abstract or drug ad and go straight to the table because this is what's going to allow me to solve this problem. Okay, so I know it's kind of hard on this to go back and forth, but remember on the very first problem here, it said, it reads, 52-year-old man with hepatic cirrhosis comes to the emergency department because of a 3-hour history of vomiting blood, esophagogastroduodenoscopy, confirms active bleeding esophageal varices. Based on the abstract shown, okay, this thing, which we're going to read in a second, the physician is considering emergency portocable shunt procedure rather than endoscopic sclerotherapy, EST. According to the results in the abstract, approximately how many patients need to be treated, So it's number needed to treat between EPCS and EST. So we go back here, and remember what I said, it was for the recurrent portal systemic encephalopathy, which is right here. We look at EST, EPS. Okay, so again, all we're doing is doing the math problems first, which are in the table. Now, we have to find the event rate. So recurrent portal systemic with this procedure is 35%. With the EPCS, it was 15. Okay, so we have our two numbers there, right? And that's all the number needed to treat actually asks for. So we don't care which one comes first, right? So we go back there, and essentially it's going to say 35%, or 0.35 minus, right, that's part of the formula, 15% or 0.15. And all we do is take that from the chart. So we do that, 0.35 minus is 0.2. And however you like to do your math, you can use that calculator that's on the exam, but 0.2 is 2/10. We do the inverse, all that kind of good stuff, and we would get a number needed to treat of 5. Okay? So again, the first problem was strictly math. Did we have to read this entire abstract to get that? No, we go straight to where the data supports it, okay? It's a very quick way to get going on these problems. The second math problem says, which of the following conclusions is most appropriate based on the results presented in the table? Okay, so we got to read through these, and we're going to apply that whole, exclude the bad choices and select only the ones that I can prove. Is it the 95% confidence interval for the difference in the survival between EPCS and EST for this child Class A patients includes 0 years? Well, when I look at this, I'm not seeing anything in the table that really talks about confidence intervals. All right, there's no even when I scan this thing, it doesn't really talk about confidence intervals real quick. The only time I see confidence interval is right here, but it's not talking about this. And forget if I'm pronouncing that incorrectly, but when it talks about those classes, the 95% confidence between the difference in the survival between these patients includes 0 years, I really don't see anything in the chart that talks about confidence intervals. So for me, I just kind of put a little question mark saying, okay, well, I really don't know. I don't have any data to support yes or no on that. It's just not there. That EPCS is more effective than EST in decreasing hospital readmissions for variceal bleeding. Okay, well I know it's got to be in the chart because they told me they told that this table is going to have everything. So that EST again, the question is that EPCS is more effective than EST. That EPS is more effective than this one. Well, for the number of readmissions, so here's readmissions, okay? And so we're dealing with these two numbers right here. So the mean number of readmissions was particularly less, all right? It was less in the EPCS than it was in the EST. So for that one, as far as mean number of readmissions, I'm going to say, well, yeah, the EPSC was more effective because it had less number than the EST. So this one's looking like a strong, I'm going to give it like a kind of a half thing there because I really like that one. Well, at least I like it a lot better than I like answer choice A. C says the median survival after EPCS is statistically significantly less for child PU class C rather than B. Now here's where we're getting into that whole formula, okay? And then remember that formula that we're going to have to remember is Z, and it's A minus B over the square root of A plus B. Now all that means is we got two numbers, right? A and B, two numbers, and we're going to see if are they statistically significant or not. And this goes back to taking two numbers, plugging them in, and getting some number that we're hoping to say it's statistically significant. It's got to be 0.05 or less. So that number, when we punch it in and it comes out the other end, it's got to be 1.96 or greater. So let's look at this. The median survival after EPCS is statistically significantly less for class C than class B. Okay, so, well, let's look at this. It was for EPCS, which is right there, and it was comparing class B, so the 6.19, with class C, which is 5.3. So there's my two numbers, okay? So all I care about are two numbers at this point. And let's just take this right here. When it said class B, that was what? 6.19. Class C is going to be 5.3. Now this might seem like overkill, especially if you're already saying, well, look, didn't you say choice B was the best answer? Yes, but we're just kind of trying to do for completeness here. And this is a very simple test that if you get used to doing it, it can show you whether two numbers are statistically significant or not. Okay? So anyways, if we did this, A minus B, so 6.19 minus 5.30, and we're going to get 0.89, okay? So 0.89 goes on top, and then A plus B, we're essentially going to get, A plus B is going to be 11.49, and you got to take the square root of that. Of course, you can get a calculator and punch all the numbers, but essentially you're going to get 3.39. And again, you're not going to be able to do this in your head. If you would, you're probably not going to be watching this video. And so if you put 0.89 divided by 3.39, you are essentially going to get a number called 0.26, okay? Now, all we said that you had to remember is 1.96. Is that number greater than that? And the answer is no, right? It's some number a lot lower, so the p-value is going to be too big, so there is no statistical significant, it's not statistically significant, that correlation between those two. The difference between them is not statistically significant. So answer choice D is going to say the randomization procedure was ineffective in decreasing the bias in the study. It's hard to say when we talk about biases in this. It really, I can't pull that from the chart. And up here, if I scan, I really don't see anything that's talking about bias when I go through here. So I'm going to say on that one, I don't know. It's possible, but I don't know. So when I do my answer choices for this one, the only one that I can prove, remember, the only one that I can prove is going to be answer choice B, okay? So again, this seemed like a long time for these problems, but the more you do these, and if you have that little process of scan the questions, do the math problems first, okay? Do the math problems first. And then you come down to the very last one that says, which of the following most strongly limits the generalizability of this study? Okay, now generalizability is just how much this study applies across the board, right, across the entire population. So we got to say, was it because the allocation was concealed? Now here's the deal. We got to, at this point, I'm not sure what all this means without actually kind of scanning it and reading it. So I'd say, okay, in the patient with cirrhosis, acute bleeding varices, okay, and it's comparing control of bleeding and survival versus those two procedures. Okay, my method, it was randomized controlled. Allocation was concealed. You know, allocation is essentially, you know, how you disperse the patients out. It was blinded. But it was only blinded by the provider there, and who evaluated the patients. So it didn't look like the patients were blinded. Follow-up 17 years. There's the N. Okay, and again, you just kind of scan through here, and eventually it almost becomes too much. So then for me, I go back to this. I go back to the problem. Which of the following most strongly limits it? Allocation was concealed. Okay, well, maybe. Do I know? Well, they didn't really tell me much about the allocation or anything other than that it was, you know, it wasn't given. The EPCS is available only at specialty centers. So would that limit it going across the entire population if it was only performed at a certain center? Okay, sure, maybe. The follow-up period was too short. I don't know. The thing said the follow-up period on this one was up to 17 years. So I don't know. It just seems a bit like kind of long to me. So to me, it's just not a great. It's a maybe, but it's not a very strong one whatsoever. The patients were not blinded. Okay. Well, would that impact generalizability? Let's think about this. This study was really just was between two procedures, right? It was just between this, you know, emergency portocaval shunt and the sclerotherapy. So, you know, it wasn't like there was a placebo involved. So the fact that the patients weren't blinded isn't as impactful in an objective test or study versus a subjective, right? Now, if it was a subjective, where you had subjective answers, then yes, the patient's not being blinded to what they were doing or something. If it was a subjective response, then it would be very impactful. But the fact is, this was more of a, you know, more of a procedural study, not as impactful. Now, if the examiner, just as a side note, if the examiner was not blinded, say the examiner kind of knew, what kind of bias was that? We'd say that would be a confirmation bias, right? That's if the examiner wasn't blinded. And then what do we call it if if you're taking like a survey to a certain group of people, or if it's like it's a survey at an election poll where there's certain types of people there, you know, that would be more of a selection bias. But we're not going to get too kind of hung up on this guy because the patients were not blinded. When it becomes like when it's an objective, essentially it's a procedural thing, it's not as impactful. So I'm going to eliminate that one. And then unmeasured confounders were not controlled by the study. You know, when I skimmed through this, I really didn't see too much that was explaining, you know, confounders or, you know, anything like that. So, you know, something that may be related to the outcome, you have to kind of tease it out. I just didn't get that when I scanned through it. So that's kind of a less than maybe. So the top two of my choices that I go for is between the allocation was concealed or the EPCS is only available at specialty centers. Now, if I was to choose one of these between these two, the one that's a little more specific is the fact that this thing was at a specialty center, which again is probably a certain type of person there. Perhaps they're the only ones that could afford certain type of insurance. So it's more precise, and there's not enough information to really get me excited about the allocation piece. So the only choice, the best choice, is going to be answer choice B. But go back to our strategy here, okay? I said, look, for these statistics drug ads, they ask a lot of correlation if things are statistically significant. Now, there's different formulas for this, but this one's going to work for us, okay? This doesn't deal with all that mean, standard deviation kind of stuff. It's just going to do two numbers and see how they correlate. If the number spits out is 1.96 or greater, then we're going to say yes, okay, because that means p-value is going to be small, okay? So we like that number. We don't care about any of these other guys, okay? And for the most part, I don't care about any of these. All I want you to know is basically 1.96, or even think of just the number 2, okay? If the number comes out 2 or greater, it means it's significantly different. There's a significance there. So then you're going to scan questions, only do the math problems, exclude the bad choices, and select only what you can prove. And again, that worked for this one. I mean, worst case scenario, if you would just held with the do the math problems first, you could have easily gotten 2 of these correct, and then you can worry about this one and maybe even have some extra time. But always do the math problems first. You have the best chance of actually getting those correct. So now, when it comes to, there's other one. Now here's a drug ad, and again, this was taken straight from the USMLE practice problem website. And so you can see it's a lot. And again, we're not going to get buried down in this. We're just going to scan it, look at the charts real fast, and then go straight to the questions. All right? What's our strategy? Are either of these math problems? Okay, when I look at this one, it says which of the following is the most appropriate response for the patient's request. Okay, that's not a math problem, so I'm going to put it on pause. This one says which of the following interpretations can be made correctly from the graph. Okay, whenever there's a graph, to me that's going to be a math problem because it's something I can pinpoint. I don't have to read the entire thing and get bogged down. I can go straight to something and see if I can get the answer. Okay, so which of the following interpretations can be made correctly from the graph on blood pressure reduction in the advertisement? Okay, and see if we can fit them both right there. Hopefully that's on the screen for you. It says, I'm gonna try it like this. Try it. Just sorry about the delay. Let's see if I can get it just so we can see these things. Okay. Which of the following interpretations can be made correctly from the graph on blood pressure reduction in the advertisement? Is it A, blood pressure reduction from the 3 doses of Escepro cannot be compared to the reduction with placebo because the number of patients on the active drugs are higher than the number of patients on placebo? And so when I look at this, I'm like, okay, what are they trying to say here? That the N for placebo is 159, N for the 1 milligram was over 400. So all these were over 400. The dose of this drug was 1 milligram, 2.5, and 5. And there's your systolic and diastolic. So we're just reading this graph. Graph says how many points less did it go down when you took placebo. Of course, when you're, I guess it was seated or something. It went down systolic, almost, a little over 3, diastolic over 4. But when you took this medication, systolic went down 9. And went down diastolic 10 on that dose, and so on. So, can you infer, or can you, from this, that the blood pressure reduction of the 3 doses cannot be compared? I don't know. So they're saying, is it significant or not? And it's hard to, on that one, it's really hard to say. So, for me, when I look at that, I'm like, all right, that's just too much. There's no correlation between those. So I'm just going to put a little, kind of a question mark right there with that one, because maybe there's a better answer that I can prove later on. Is it B, doubling the highest dose of the medication will decrease diastolic pressure from baseline by at least 15 points? So when you, doubling the highest dose. So, the highest dose is 5 milligrams. We can't really say that it's going to decrease it. We don't know. But if you're even to double the dose at the 5 milligrams, it's only going to go down, the systolic is only going to go down by 11, and the diastolic is at 13. So I really can't say that even doubling it or even at the highest dose is going to get us to this 15 mark. So I just don't like that one whatsoever because I can't prove it. Is it C, the highest dose of Escepro should be used because it offers the greatest benefit? Now, from the graph, because remember, it's saying look at the graph and determine this. Well, we can't really, we really can't say that it gives the greatest, because these are actually, when we look at these are pretty tightly correlated. So we can't say that it offers the greatest benefit because we also don't know what side effects, or we can't infer that from this. So I really can't say that one because it's not like it's overwhelming, giving us the greatest benefit. at the highest dose. And is it D? There is no clinically important difference in blood pressure reduction between the three groups. Okay, well, how do I know that a systolic of, say, a decrease in 9 is significantly different than a systolic, say, of 11? Okay, or let me see, let's just do the diastolic. Okay, on this one, diastolic is 11. And we can say the diastolic on this one, one of these is 12, okay? So 11 and 12, those are my two numbers, right? Now, what do we say? What do we talk about that formula? Z, right? How do I tell if something is statistically significant or not, the difference? So we say Z, and remember it's A minus B over the square root of A plus B. Now, we got our two numbers, right? It's 11 and 12. It could be 10 and 11. I mean, 10 and 12 doesn't matter. If it's any simpler, we could do 10 and 12, just to give you more of a spread. Okay, say it was there. If we're comparing diastolic, we can go 10 and 12. So 12 minus 10, or square root of 22, and so I get that, and then the square root of 22, and if I was to try to look on a calculator here and try to get the square root of 22, if I don't know it, then I would just go to, what's my next thing that I can do is 5 would be 25. And so it's like this. If I was to eyeball that, I know you got a calculator on your exam, but if I go square root of 25 is 5, square root of 16 is 4, and so the square root of 22 is going to be up there closer to 5, so I'd give it like a 4.75 or even a 5. But nevertheless, 2 divided by 5 is going to be 0.4. Now, what did we say? We said it's got to be at least what? At least 1.96 or greater to be significant. So there is no clinically important difference in blood pressure reduction between the three groups, right? Because even at their worst extremes, and between, say a 10 and a 12, you're still getting an insignificant difference. It doesn't overcome this. So right now I'm liking that one because I can prove that. I can prove that there was no difference between that. And then E says the significance of the drug effect versus placebo cannot be determined because of the low p-value. Well, where's this whole p-value thing at? So when I read through this chart, because that's where they told me to focus, there's a p-value buried in here. You probably can't see it, but the p-value there says it's greater than 0.5. Well, we should know from basic statistics that you need a p-value less than 0.05 to be statistically significant. So the significance of the drug versus placebo cannot be determined because of the p-value. Well, there's a high p-value, not a low one, so we're going to eliminate that one. So out of all these answer choices, and we went straight to the math problem, the only one that I can prove on this is going to be answer choice D. Now it seemed like a lot, but the key is on this, you gotta keep doing these problems to where you start working it and you can start actually using this statistical, this whole Z thing. And honestly, I didn't use this too much until I started doing all this kind of stuff and trying to learn a strategy, because this is one that's going to help us through these types of problems. You solve that, you look for this number or greater, and if it is, then there is a correlation, okay? If it's less, then there's not. So back to the last problem that it had there, and just by reading it, it says, which of the following is the most appropriate response to the patient's request for the medication? So the answer choices are, without even reading the rest of this, espresso should be prescribed because she can get it free. Okay, well, let's do this. Let's figure out about this lady first. She's 65, comes for blood pressure medication. History is poorly controlled. She has hypertension, psoriasis, psoriatic arthritis, previously treated with methotrexate. Alcohol use disorder, elevated liver enzymes, treating on multiple medications, vital signs of this. She's got this physical imaging discloses thick, scaly plaques on the scalp, so she's got the whole psoriasis thing going all over the place. The severe spider angiomana. Now, when you think of that, what are you thinking? It goes back to this whole liver thing, right? She's probably got some chronic stuff going on. Abdomen distended and a fluid wave is noted. All right, so she's retaining a lot of fluid. Liver's probably not functioning too good here. 2+ edema. She'd like to try a new drug called this thing. Okay, so we start looking through the answer choices. Which of the following is most appropriate? Espro could be prescribed because she can get it for free. Come on, we all know that that's probably not going to be a good answer choice. Should not be prescribed because it worsens her psoriasis. Well, we don't know. We have to read the thing. Should not be prescribed because it's similar to other medications. We don't know. Should not be prescribed because the patient has severe liver disease. Okay, it's always something to worry about. Espresso should only be used for hypertensive emergencies. All right, so to answer this one, we have to actually, we actually have to scan it. And so from here, we would see it's just a blood pressure. We've already looked at this one. There's meaningful reductions. There's 1 milligram, 2.5, and 5. The number, significant reductions in heart rate. Okay, but remember, we're looking for this whole thing, psoriasis and this thing about the liver were the two deal breakers in it. So it's significant women and minorities, it appears. Is a beta-adrenergic blocking agent, so it's a beta blocker, so keep that in mind. But if we went back, it doesn't look like she was on a beta blocker. She was on an ACE inhibitor, spironolactone. Okay, so she wasn't on another another beta blocker. And then here it talks about adverse events, but that really wasn't part of any of that question thing that we talked about. And then most side effects were mild, did not require discontinuation. No significant were observed. Drugs that inhibit 2D6. Know this for all your STEP exams. All these inhibitors, I mean, I don't want to stop in the middle of this one to do it, but when in doubt, if you don't know inhibitors, always go with 2D6. 2D6, really common. But in this one, it's a 2C9, okay? And then down here, important safety information. Patients treated with this medication have against sudden discontinuation. It's contraindicated in bradycardia, heart block, first degree, and severe hepatic impairment. Okay, right? She had the fluid wave, all that kind of good stuff. She should be used in diabetics as beta blockers may some manifestations of hypoglycemia. Okay, all right. So back to our best answer choices. It said nothing about because it can worsen psoriasis that I read. Should not be prescribed because it has similar to other medications. She's not on any other beta blocker, so I'm not too worried about that one. Espresso should not be prescribed to patients with severe liver disease. Well, it did mention that, okay. And espresso should only be used for hypertensive emergencies. It didn't really talk about that. So the best choice, the only one that I can prove, is going to be this liver disease. Now, again, if you don't read the questions first, I mean, you're going to waste a minute. I mean, these problems are long, and that's why I don't like them. But there's no sense, at least in my opinion, to read all this stuff unless you're really zeroed in on what you're trying to focus in on. So always read the questions first. And what are you going to do? You're going to look for the math problems. You're going to exclude all your bad choices, and you're only going to select the ones that you can prove, because sometimes everything sounds good, but you're only going to do the ones you can prove. And you're going to know this formula right here. Now, I think there was one other question that I had for you guys. And trying to find, here it is right here. Last one, okay? When you see something like this, the reason I bring this in, because these drug ads, it's all, I'm telling you, most of the time, it's all about the box. It's all about what's in here, okay? Now, when you see confidence interval, the one thing you want you to look for is when it crosses 1, I want you to think that it's no good, right? Because that means that there was really no difference between treatment and placebo, right? At some point it was equal. That's what the 1 means if it crosses that 1 in the confidence interval, right? So for me, without even reading this problem, I'd go down here and switch the data is correct. Okay, well, I'm looking at this. I don't like any of these problems. I automatically eliminate the ones where the confidence interval crosses 0 because that data is irrelevant to me. I can't use it, okay? Yet this one doesn't cross 1, so it catches my eye. What about p-values? I only care about p-values that are what? Less than 0.05. So offhand, even though this is a long problem, I'm zeroed in on this one right here, which is talking about this. So look at the question. Based on these data, which of the following is the most appropriate conclusion regarding the 5 potential risk factors for the transmission of HCV? All factors appear to have an effect. You can't really say that, right? Some of the information was garbage. Fetal electrode monitoring was protective. Again, it crossed zero. I don't like any of the data that talks about that. Infant HIV infection was the only significant associated factor. Okay, and it looks like compared to all this data, that looks like it's a possibility. Maternal chorioamnionitis was most significantly? No, again, bad data, okay? So there, and then no factor was significantly associated. No, we can't say that because there was one that was associated. It's going to be the HIV, answer choice C, okay? So the point of using this one, and again, all these problems I pulled were from that USMLE.org. This is the stuff they want you to know. But if you can attack these problems just by ruling out the garbage stuff. But I'd say, again, it's going to go back to this. Scan, look for the math problems first, exclude your bad choices, and only select the ones that you can prove, okay? Without a doubt, you can say from this information, from this data, I know that this one would be a good choice because I can prove the result. And then know this formula because it's going to save us when it comes to comparing, if I got to compare two numbers, I can see if they're actually statistically significant or not. And that's going to come important, especially when we're trying to compare like graphs and stuff like that. Okay? So guys, I hope this was helpful. I mean, it was a bit long, a lot longer than I was hoping. But again, if you just apply these to the drug ads, I think we can kind of get through this. And again, focus in on the math problems. Those are the ones we're going to definitely get right. Okay. All right, guys. If you have any questions, make sure you send some problems to me. We can solve them. Otherwise, we'll see you in the next video.